Welcome to the Path to Be Well podcast, a podcast about being well. I'm Doug Rawson. Join me, Mark Tremblay and Paul Clory each week as we answer your questions with the sole purpose of helping people who suffer from a chronic medical condition in considering the safe use of cannabis so you can have a better quality of life. In this podcast episode, Mark and Paul help bring awareness to chronic pain while establishing treatment goals. Through a discussion of a previous guest, conclusions and tips are drawn that can help provide confidence in your choice of treatment with cannabis. Listen to hear more about pain types and how to create your treatment plan around pain. We hope this quick tips episode will help form a treatment plan aligned to your health goals. If you have a topic that you'd like covered in a future podcast episode, please leave a comment at weedwell.com.
Hi, welcome to our broadcast, The Path to Be Well, Knowledge and Learning Session. To all our listeners, we're so happy that you've joined us today. Please note that you can also subscribe on our YouTube channel or find us at weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do us and them a favor by sharing this event. My name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded that it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many, many years later that I discovered the true medical benefits of marijuana. You see, a loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I did witness firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open, my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients, ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I do want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So today I have my colleague Paul Clory joining me. So Paul, welcome.
Thanks, Mark. It's a wonderful day today. And I know you've been sharing with our audience different things about our topic today, which is pain, through the week. A little tidbits of information as you were running through Be Clear, Be Aware, and Be Informed leading up to today. And so we hope to continue off that. Pain is in our Be Aware category, and Be Aware is all about understanding your conditions and developing a treatment plan, a SMART goal. That's in our roadmap. Our roadmap you can find at weedwell.tips. To share a story today, if you could, Mark, I thought episode 12 in our podcast.weedwell.com, was a story about Cynthia. Cynthia was dealing with pain, much more than just that. And I would hope, or I'm hoping, that you can share a little bit about her story in that interview, and then we'll tie it together with the roadmap and the manifesto I'll bring up very shortly.
Yeah, for sure, Paul. I'd be happy to do so. And Paul, as you would know, any of the guests that we've had, any interviews that we've had, if we can call them that, with some of our clients, I mean, they all have amazing stories. And it's no different for Cynthia. As you said, episode 12 in our podcast, Cynthia was diagnosed with chronic Lyme disease in 2013. And for her, I mean, there was a number of issues as she identified roaming joint and muscle pain, brain fog, headaches, anxiety, depression, all of that. She is a mother. She also had a job as a nurse. And I like the term that she used, the silent pain. In other words, when she was at work, she had to camouflage that and still perform her duties towards her patient. But she found it very struggling, to the point that all she could do, literally, according to her statement, is that sleep and go to work. Anything else, she could not do that. Through exhaustive measures of trying a variety of therapies, she did conclude that through a consultation with her nurse practitioner, who was familiar with Simcoe Holistic Health, that perhaps cannabis might be a viable option for her. And she did take that path. And for her, it was important because she was a little familiar with cannabis, being, as a nurse and talking to many different people. But she wasn't, let's call it, a fan of it. So she came in with a little bit of skepticism, if you like. But the nurse practitioner assured her that there's really nothing to be too concerned with, that she had many patients with cannabis therapy that were seeing, good results with little, if any, negative side effects. So that encouraged her, and I guess gave her the motivation to try that. But for her, as a medical professional, it was very, very important. And her words was to be guided by health professionals in that journey, those that understand medicine, that understand cannabis, how it works in the body, what is good for what symptom. So for her, that was very, very important. As I re-listened to that session, her comments were saying that the first night she slept better and she felt better the next day. She said, I didn't feel hungover, brain fog had somewhat lifted, and that she also felt that her joint pain had diminished. Now, a word of caution to our listeners, this does happen, but it doesn't mean that always happens this way. So, Paul, I'll let you kind of carry that from there.
Okay, thank you, Mark. So, a manifesto today ties into this story, and it's I have confidence in my choice of treatment with cannabis. And the reason it ties in is it goes to Cynthia's quote that you mentioned, Mark, that she wanted to be guided by health professionals. And she continued that thought with knowledgeable in the plant, in disease processes, as well as symptoms and how it would relate to her. So in that sense, what strain or what type of cannabis may help her. And so that gave her the confidence to take the leap forward as well. And so for this story, let's take off to pain itself. With regards to the pain, statistics, at least in North America, would suggest 20% of the adult population suffers from some form of chronic pain. And that number in itself leaves me kind of like, whoa. If you walk into a grocery store and see 30 people, 6 of them in theory, suffer from some form of chronic pain. You wouldn't notice that because you're walking around a grocery store, but just to highlight how many that there are. In Canada, that number is estimated around 7 million people over the age of 15. Recently, there's been a Canadian task force report, and this is very recent, October 2020. I wanted to share some things with you from that. And so they estimate in Canada, it's around 25% of people over 15 that suffer from chronic conditions. There was a couple interesting things in this report. Like Cynthia, who had long time suffering and kind of was at the end of going through treatment, one of the things this report shared is the actual effect of COVID on these patients. And this is a little off topic, but I think it's important because it's all encompassing to the person suffering from the chronic pain. And one of the things the report brought up is the decrease in services. And I can think of my own life. I had one procedure that was scheduled that got canceled shortly after COVID started. Well, multiply that across the board of wherever you live. And so that's more suffering potentially. And the result from that is this report has, one of the studies inside this report, I should say, has found that there's been an increase of 47% of opioid and cannabinoid prescriptions because people aren't able to do the adjunct therapies, whether their chiropractor was closed, their massage person, whatever the adjunct therapy, the additional therapy, they result in going back to, and Mark, we know this from the clinic, people want to get off opioids is a common reason why they end up seeing us at Weedwell. And this COVID has actually resulted in pushing some people back the other way because the only intervention that's available is a pharmaceutical intervention. A little off topic, but I wanted to point out that for someone who's already having a rough time dealing with the chronic pain on a daily basis, you highlighted that very well with Cynthia. In today's day and age, in today's world with COVID, it's been magnified huge and made worse in a lot of ways. No one's fault in particular, but it's just something that has happened.
Yeah, good point, Paul. Yeah, and I definitely agree that this was worthy of sharing that information and even the impacts, because we don't necessarily stop to think of that, but it's a reality that is out there. And as you're mentioning that, I kind of look around and what I've observed to be exactly that, just from speaking to people and them sharing their stories and the impact that it's had on their lives. So absolutely, Paul. Yeah.
So into the actual discussion of be aware, like we're going to define pain today, and that's kind of, we'll say, the meat and potatoes of today's discussion. And so the first thing we want to talk about is time frame. And time frame is usually what you'll see is defined by 6 months. So 6 months or less, we're talking an acute type pain. And generally, it's much shorter than that. And so if we use an example of a car accident and you have some sore, stiff muscles following that car accident, a normal time frame to repair, heal, not be in pain might be days, might be weeks. You might be stiff, but then you notice that it's gone. Chronic pain, by definition, doesn't heal in its normal amount of time, or after the underlying cause of the problem is resolved, the pain's still there. And in a timeline sense of things, we're talking more than 6 months. Cynthia is a great example of the type of client that we see on a regular basis from the point of view of the length of time that they suffered, but it leads into the amount of treatments that they've been through. And we've talked about Corrine before. The pain pump wasn't necessarily the first treatment, but it was one of multiple treatments. Cynthia went through multiple treatments, and this is very common for someone suffering from chronic pain. So that's the kind of the length of time, the time frame. We want to define our pain on what it feels like. Is it a shooting pain that goes down into your legs because of a back issue pushing on a nerve? Is it a constant ache in your belly that's always there? Does it feel like someone's sitting on your chest or squeezing you? Is the pain throbbing like in a toothache? Being able to define your pain is very important as well. Okay. We'll move on to constant pains and what we'll call colicky type pains. And I know you've talked about this previously. So simple terms, colicky pain is pain that comes and goes. Or you notice it amps up quite a bit and then settles down. And for colicky type pain, we're thinking a lot of times in belly, hollow organs, as an example. The first two things that come to mind, Crohn's and ulcerative colitis. For constant pain, this would be your nerve type pain because the bone is constantly pushing on the nerve and it's going to constantly give you pain to where that nerve goes. So that's kind of the type, if you will. Severity of pain is also important to define. A lot of times people will use, or clinicians will use, a scale of 1 to 10, 1 being very little pain, 10 being the worst pain that you felt. And people will put their finger on a number that is right for them. That in and of itself has no bearing, but where we'll get to in a minute and we'll talk about SMART goals, it absolutely has a bearing for you. Mark, you constantly say your journey is your journey, and this is where it's going to play in, and we'll tie that back in a second. I've also seen kind of, we'll say, distressed faces as a scale, and I remember seeing that in the OB area from when our first child came, And it was kind of the stages of labor. And you think you're in pain now, but you have 3 or 4 or 5 more steps to go. So it goes from kind of a wince to the person full out crying, as an example. So whatever that scale is, it gives you an idea of something not so bad to something really bad. Finally, you want to think about how it affects your activities. And it doesn't matter what that activity is, if it's strenuous, if it's something you do for leisure, whatever the case may be. When you go to figure out what you want to do, sometimes that what you want to do is exactly what you've been missing. So if it's playing a round of golf without having to stop after 9 holes, let's say, as an example. If it's hitting a tennis ball and playing, one set of a match with someone. If it's just walking and getting out and getting around the corner and enjoying the fresh air as springtime's coming now, that's a good way to define it as well. Again, it can be something really, we'll say, intense and physical, or something that's just an activity of daily life. And, for a lot of people, that activity of daily life or daily living, as we say, that's so important. Being able to get up, get to the shower, be able to clean yourself, it just makes you feel much better. So again, it can be something really intense or something really basic, but all are important and important to you. That's kind of like a lot of different ways to define your pain. You got any thoughts on that, Mark?
Really, a comment, Paul, is, as you mentioned, starting last Monday, Tuesday, and Wednesday, I do a couple of mini episodes every single day. And each of those episodes was kind of leading to the episode with you today and building on that a little bit. But what you've already done is really encapsulate all of that very well and added so much more, the term that you use, meat and potatoes, to that. So, yeah, I'm sure those that are listening either today live or in our podcast will certainly get benefit from that.
Hi, Doug here from Weedwell. I wanted to hop in here for a moment as we're excited to share with you how we see our Facebook community grow every day. I want to extend a warm welcome to you in joining our community to get tips, tools, and resources while collaborating with others to support you on your health journey. Look for us at weedwell.group.
So after we've defined our pain, we really stress putting the work in and getting a handle on things in this be aware. The goal is set a SMART goal at the end of this. So we've established where we are in regards to the pain. We've been able to define where we're at, how it feels, what I'm experiencing, what I'm dealing with. We want to see where we are in the future. That's the SMART goal. And we've talked about SMART goals specifically before in this forum. And so you can revisit that. Again, podcast.weedwell.com. The SMART goal episode will be there. But in order to see where you want to be, having that framework of where you are. And so if you want to define it by I'm pain-free, it might not work for you. And we've talked, cannabis is not the miracle cure-all, but it can make things better. We've talked cannabis as a tool in the toolbox. So whether it makes things better that you can go to physiotherapy and repair the torn muscles or whatever the case may be, or that adjunct therapy, it might just be a tool in the toolbox. Having defined your pain in these 3 or 4 different categories allows you to pinpoint different things that you want to do. Pain-free might not be it, but walking around the corner might be. Like I mentioned, the activities of daily life, being able to get up and clean yourself, or getting up and vacuuming or cleaning your house. That could be super important to you. That doesn't mean you're pain-free, but it might be that you're able to work for 15 minutes at a time and accomplish some things. Then you have to take a break, and that's okay. Or it can be some more of the strenuous activities that I mentioned already, whether it's playing a round of golf or hitting a tennis ball or being able to play some other kind of sport or activity that you used to do that you can't because the back pain is holding me back, the knee pain is holding me back. And so you really get a good, clear picture of having done the legwork of where you want to be. And you can start picking those things out, as opposed to just saying, my pain scale is 8 out of 10 and I want it to be 0 out of 10. start looking at it, we'll say, more holistically, and you start picking these things out. I can do more. The other thing you might see is I'm taking less opioids. So we talked about medication substitution near the opening. That's a common thing, that people want to decrease their opioid use. And that might be something that you notice, I was taking 4 a day and now I'm only taking 1 a day, and I'm just as good. So there's a lot of ways in that SMART goal to measure pain and to measure or set yourself up for success and goals that matter to you.
Yeah, Paul. And what comes to mind when you're going through all of this is a couple of things. One of them is, it's not such that pain is pain is pain. There's so many different types of pain. And as a result of that, how you treat your pain could be different and will likely be different than someone else that you know who's treating pain. In fact, you and I have heard this numerous times, someone coming to us and say, hey, someone I know, someone dear to me, has found really good relief by utilizing cannabis or introducing cannabis in their treatment plan for their pain. I'd like to do the same thing. And we say, let's pause and look at you specifically, where you're at. What is the nature of the pain? What medication are you currently on? All of those things. So it all ties in with what our listeners would have heard us say many times before. Cannabis is not a one size fits all. It doesn't mean that what's good for one person, the same thing will be for the next one. So there is some work that needs to be done, identifying the pain and devising a treatment plan appropriate for that pain condition that you have, with everything that you've mentioned to this point.
That's exactly it. Piecing together your path to be well. And I know you've been working throughout the week with presentation from be clear to be aware, to be informed. And that's piecing together your story, your where you were, where you are now, what goal you want, what's important to you. And as you just mentioned, in Be Informed, setting a treatment plan that matters to you, that will work for you.
Mm-hmm. And Paul, we do know that it is a process being that it's not pop a pill and everything goes away. And sadly, we're all probably a little guilty of being in a society that we are looking for instant results, whether it be looking online for something. We expect to see something really quick. With all of the drive-throughs that are accessible today, you're just driving by and obviously, your belly or your brain tells you you're hungry. You just drive through and you get a quick fix. One thing, a common denominator between all of the stories from our clients that we have heard, is that it is not that. Even if they see, noticeable results early on, it is a journey after that. It means, adjusting and overcoming the little bumps in the road and looking back and readjusting and those sorts of things. So it is definitely a process. And with pain, there's a lot of moving parts. There's a lot of things that need to be identified up front to be able to, get a good grip on that and come up with a good plan.
Yes. Cynthia's story was exactly that. And she was quite adamant and correct in her assessment. I did the work. The cannabis allowed me to get to a place, but I did the work, and that shouldn't be lost.
Yeah, no, for sure. And she said that very, very well. And she used the term, the tool in the toolbox that helped her get there. And you touched on it a little earlier about adjunct therapy once or twice. With Cynthia, going back to her story, her testimony, is that one of the reasons why she would have been reluctant to cannabis as a treatment plan or option is that all her life, as she shared, had been struggling with weight issues. And she had also heard that cannabis can give you munchies. So that would have been counterintuitive to the overall goal of what she was trying to accomplish. So she refrained from going on that path, with that being one of those reasons, perhaps others. But she was quick to say that for her, it did not have that effect. In fact, with all the positive effects, it allowed her to take part in adjunct therapy. And I believe she had a elliptical machine in her home and started doing more of that. And we all know that that is so therapeutic in more ways than one. Physically, obviously, but I think mentally, emotionally, it has a positive impact there as well. And if you happen to be, well, first of all, getting stronger physically and dropping some pounds, I mean, it all compounds on each other. And a little side note, but it's a huge one for her through that process with cannabis as a tool in the toolbox and doing all those other things that she mentioned, she was able to drop 85 pounds. So that's how powerful, getting control over your health condition, recognizing it, taking some steps and monitoring the results and adjusting moving forward. There is hope for anyone that is out there listening to this, that this can be you, but you have to do the work.
Yes, I think what you said, Mark, it's essentially summed up as everything that happened was rooted in Cynthia, from identifying the issues, gaining the confidence to go with cannabis treatment, to setting a SMART goal that worked for her, and then the treatment plan that didn't cause the munchies, but rather aided in other alternative therapies or adjunct therapies to contribute to the overall.
Mm-hmm.
So I think we'll sum up at this point. I think we've highlighted a few excellent points, but in Be Aware, we're all about understanding the condition, in this case, understanding pain. And you want to clearly define what it is that you're suffering from, what it feels like. Does it come and go? Is it always there? How severe is it? And it allows you to make very appropriate SMART goals for yourself, which is the goal of Be Aware at the end of it all. And make sure, as you set your SMART goals, celebrate the small wins as time goes on, the small victories. If it's, using the getting around the house example, if the first thing is to take a shower and be able to clean yourself, that's a win. If the next thing is to push the vacuum around the floor, that's a win. But doing all the legwork and understanding exactly what it is that you're feeling and how you're feeling and all that plays into the SMART goals, so you can figure out what it is that you want from treatment.
Yeah, Paul, so important to celebrate the success, as you mentioned, because you have done the work. Even treat yourself because you've done the work, and share that with others that are near and dear to you as well, because I'm sure that they will be encouraged to hear that, and perhaps it would encourage them to embark in a journey similar to yours based on your story. So absolutely. Paul, closing comments before I give mine.
I think it's been summed up okay, so I think I'll leave it to you, Mark.
All right. Paul, thank you so much again today, and I look forward to a week from today. This topic of pain, as you've already mentioned, is significant to say the least. There's work that needs to go into it, and we've covered all of those points. For those that have just maybe joined us through, as we are already into the episode, you can see all or listen to all of these podcasts at podcast.weedwell.com. So podcast.weedwell.com. All of our episodes are there. It'll take a week or so before this one here is on there, but do look for it. There's tremendous information in this. And in there, you'll also find, among many others, the story, the testimony from Cynthia, and that was episode 12 in the podcast. So if you wanted more detail about that, you would find that there. So as I do my wrap up and disclosure, I'd like to remind our audience that these information sessions are intended for individuals who are in generally good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment, including mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders, and do not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. Now, for those of you who have taken some steps in improving your quality of life, congratulations. And remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Paul, myself, and the team behind the scenes, we look forward to the next time that you join us. And until then, be well.
Thanks for joining us this week on the Path to Be Well podcast, a podcast about being well. Make sure to visit our website at weedwell.com, where you can subscribe to our show so you never miss an episode. While you're at it, if you found value in this week's show, we'd appreciate you sharing this podcast or leaving a comment or rating. We look forward to you joining us next time. Until then, be well.